Today we're going to continue our series on first aid, and we're going to talk about choking, what it is, and what to do if you find that somebody is choking, both in adults and in infants. So let's say you're in a restaurant and you see someone going like this. What do? So there's lots of things that people want to do when they feel like somebody is choking. But before we even go there, what are the signs that someone is truly choking? What are the signs that someone is choking? Hands around the neck, inability to make any noise. So there'd be no coughing, there'd be no talking, no cries for help that are audible, or the face turning red. Although initially the face turns red, you might notice after a while that their lips are turning blue. Difficulty breathing. If the choking continues long enough, the person can become unconscious. If someone is still able to make a sound, they aren't quite at the level that you need to do anything yet. So if you hear them coughing, you can leave them alone. So, provided that they aren't making any sounds, what can you do for them? Many people say, oh, give them something to drink. Other people say, give them something to eat. Some people say, hit them on the back. Those are all very common things that people want to do when they see someone choking. Let's talk about what the most helpful thing to do is. To clarify, why is it important to help somebody who's choking? Because there's a possibility that they might die. To understand that, let's look at what happens when someone is choking. So here is another one of my drawings. So here's the mouth, the nose, these are the lungs, and here is the stomach. This tube here is called the esophagus. It leads from the mouth to the stomach. Here is the trachea or the windpipe that then leads into the lungs. In our body, in our mouth, there are two openings. One is the esophagus that leads to the stomach. The other is what will lead to the trachea and the lungs. So what happens when someone is choking? The purpose of the windpipe is to take air from your nose or your mouth and take it to your lungs, and that's how you breathe. The purpose of this tube, the esophagus, is to take the food to the stomach so it can be digested, and that nutrition can be used to nourish your body. So when someone is choking, what exactly happens? Let's take a look. What happens is that food goes into the mouth, but instead of going down the esophagus, gets stuck in the air passageway. And because of that, the person can no longer breathe because access to their lungs has been obstructed. The gut reaction that many people have is to give someone who is choking some water. So let's look at why this would or would not be helpful. If I am given water, where is that water going to go? Well, if it goes in the proper place that it's supposed to, it's going to go in the stomach. So is that going to in any way help the obstruction that's in the lungs? No. So as you see, the water would just end up in the stomach. Now, what if you gave somebody something to eat? Again, that should go in the right place and again end up in the stomach, having no interaction with the obstruction that's causing the choking. So food or water will not help when someone is truly choking, and again, that's when they're not making any sounds. Now, let's talk about hitting somebody on the back. That's something that everyone does, but does it help? To understand that, let's talk about science. I have this pencil in my hand. If I let it go, what's going to happen to it? Simple rules of gravity says it's going to fall. Every time I let it go, it's going to fall. And so gravity will always tend to push things down. Let's go back to our drawing to see what would happen if we push this down. So if I'm hitting someone on the back and this goes down, is that what I wanted it to do? No. I'm sending it in the wrong direction. So hitting somebody on the back is not helpful in this situation. One more thing that people often say is to turn the person upside down, especially if they're a young kid or a baby, and then they say, well, gravity would help take it out. And while that is remotely possible, we don't recommend that, as that can be dangerous. So please don't turn your child around and try to shake that whatever's stuck in their throat out of them. There is a better way, an easier way, something that works more effectively. Now that I've told you the things that don't work or you shouldn't do when someone is choking, what can you do? To understand that, let's talk about the lungs. The lungs are what help us breathe. You can think of them as balloons that are full of air that oxygenate all the blood that's in our body. So think of a balloon. If you hold a balloon and you squeeze it and the top of it is open, what happens? There's air that comes out, right? So if you put a feather right on top of a balloon that you're squeezing, that feather will move upwards. So what we want is the air in our lungs to be squeezed so that we can push this obstruction upwards so that it comes out of our mouth and we can breathe again. But how do you do this? It's not like you can just cut somebody open and squeeze their lungs, right? Even if you did cut them, they still have a rib cage around them that's full of bones. So how are you going to reach the lungs? Let's talk about what you do if the person is older than 1 and is conscious, meaning that they're still awake and they have not fainted. The first thing you want to do is come behind the person. And then you want to put your legs in between their legs. So say this is a person, you want to put your legs like this. This will help you brace. If they do become unconscious and fall backwards, you will be able to catch them. And then what you want to do is you want to wrap your arms around them. Once one foot is in between their 2 feet and the other one is bracing, you want to take your non-dominant hand, or the one that you don't normally use. You want to use your 4th finger to find their belly button. Once you do that, you want to take 2 fingers right above that and put your hand right there. Then you take your dominant hand, or the hand that you use to write, and you put your thumb inside like this and cover up that thumb. Turn your fist so that it's facing like this and put it right above where those 2 fingers were. Once you do that, you take your other hand, the one that you use to find the belly button, and you put it on top of this hand. After doing that, you will do abdominal thrusts. What those are you're going to squeeze up and in. In the process of doing that, you are causing the lungs to push the air up to where that obstruction is and hopefully push it out. You repeat that until whatever was stuck is dislodged or comes out, or the person faints. So let's talk about what to do if the person faints. Now let's talk about what to do if an adult becomes unconscious while you are doing abdominal thrusts. So hopefully your legs were positioned in between theirs, and so when they fell backwards, you were able to prop them and hold them up so they didn't crash on the floor and hit their head or injure themselves, and you gently bring them to the ground. Once they are on the ground, you may need to undress them for the top portions so that you can find the things that you need to find to make sure that you are doing the next steps right. Let's look at this to get an idea of what to do. So this part right here, the little notch that you have on your neck, is what this represents. This right here is where your ribs come together in the center. So we've got this point and this point, and then these are the nipples. An easy way to help an adult who's unconscious and now lying on the ground is to find the nipples. If it's a male, it's fairly easy. You find the nipples, and what you're going to do is you're going to use this part of your hand and place it right there, halfway in between the 2 nipples on the bone. If it's a woman who has large breasts that may be slightly saggy or it's hard to figure out, what you can also do is just go to the edges of the ribs and then go up until you find where they connect, and then go ahead and go 2 finger breadths above that, and you can put your hand right there. and that will get you pretty close to where you need to be. What you don't want to do is be right on this edge, as you can break it off doing what I'm going to be asking you to do next. So if you have ever learned CPR, you're basically going to be doing CPR without giving any breaths. So what you do is you take this part of your hand and put it right where we said, halfway in between the nipples, right there. And then you take the other hand and you interlace the fingers and you lift like this, and you're gonna compress. So let me show you how to do that in a position that actually makes sense. So here is the person again. Their head would be right here. The rest of their body is this way. Here are the nipples. And so you take your hand, take your other hand, and then you press down. And you are going to start compressing. And you're gonna keep compressing until you dislodge the piece that's causing the problem. Let me show you again. Now, remember, when you do this, your elbows are straight, they are not bent. So just remember, when you are compressing, your elbows should be straight, they should not be bent. If they're bent, you're doing it wrong, you're not getting the right pressure. Also, the person should be lying on a hard surface. If they're lying on a soft surface, they won't be able to get the compression depth that you actually need. Let's talk about how fast you go. You want to go about 100 beats a minute. And there's a song that is a very old song called Staying Alive. So if you know that song, you can hum that in your head and you'll know the beat that you go to. So it's da 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 da. Da, 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 da. If you don't know that song, just to set your phone, if you can, to go 100 beats a minute, and then that will just be able to tell you how fast you should be going. How deep are you supposed to go? So when you are doing compressions, know that you may crack some ribs as you are doing that, but that is okay. Because remember, you are saving this person's life. If they have fainted or passed out and they're no longer conscious, that means they're very close to death. And so broken ribs are better than death. So don't worry about that. But if you're very strong and they're very small, there's a possibility that you could do more damage than just broken ribs. So try not to go more than 5 to 6 centimeters or 2 to 2.4 inches. One thing to keep in mind, I can't show this on myself, so I'm using this baby, but we're still talking about adults here, or children older than 1 year old. When the person is unconscious and you found the nipples and you're using your 2 hands and you're going up and down in between the 2 nipples on that middle bone, the sternum right there, and you're going up and down, what you want to make sure is that you let the chest come back up to normal. So what you don't want to have done, and let me just show you here because it's easier. What you don't want to have done is pressed in and then not come up all the way. You want to, and just done this, or let me show you easier like this. What you want to do is make sure that you have a full recoil. If you do it like this, you won't accomplish what you're trying to do. It has to be down and up, down and up. Obviously, you're using this part of your hand, you're using 2 hands, and your position would be in between the 2 nipples in the center on the bone. So when you are doing the compressions, compress for about 30 times, and then you can check to see if you can see the object in their mouth. If you can, then you can pull it out. Sometimes they've already dislodged it themselves, or it's obvious that they have now regained consciousness, and of course you can stop. So things are a little different for certain cases. So for a pregnant woman, you aren't going to want to do the same thing because you don't want to injure the baby. So you actually want to go above the level of the uterus. And so what you will do is just like when someone was unconscious and we felt for where the ribs come together and came about 2 finger breadths higher, that's exactly what you do. Again, except you will use the same fist and hand, and you will go ahead and compress them right there. We talked about how you use 2 hands on people who are older than 1 year old. However, if the child is very small and you are larger, 1 hand may be enough. What you don't want to do is have that person's legs lifting off the ground as you are doing the upwards inward thrust. So you might have to use a little less force and maybe just 1 hand for younger children. Lastly, what if there's no one around and you yourself are choking? What do? You can actually use the same principles and the same methods. So one thing that you can do is just find your own navel, go ahead and put your thumb in and close your fingers, and then use the 2 fingers above the navel or belly button, stick your hand and give yourself the abdominal thrust. Now, oftentimes that isn't enough pressure, so what you can actually use is the back of a chair or that's hard or something else, and you put the hands in the same position, but then you actually fall on that chair and give yourself the abdominal thrust to let that come out. Let's talk about what to do with infants or babies that are less than 1 year old. So say your baby accidentally put something in their mouth that they shouldn't have, and you see that they're choking. And now babies aren't necessarily going to grab their throat the same way adults are, but you'll be able to tell that they're choking. They won't be making any sounds, they'll be struggling. And so what do? First thing you want to do is take off the baby's clothes, at least the top portion, because you will need to have access to be able to see the baby's anatomy or body, to know where to put your fingers and what to do. So when you have a baby that has a bare chest, you will be using the 2 nipples to locate where you need to put your fingers. And on the back, you want to use the shoulder blades of the child. So the first thing you do if the baby is choking is you can take a look inside the mouth. You don't want to just blindly sweep in there trying to get something, because you might actually push something in deeper than it should. But if you see something, go ahead and pull it out. Now, if you cannot safely pull it out, the first thing that you want to do is to take your thumb and your first finger and form a C and put it around the jawbone here. You want to use the first finger and not the second, because if you use the second finger, oftentimes you'll end up covering the nose of the baby. So while you're trying to save its life, you'll actually be cutting off its way of breathing. So use the first finger and the thumb around the jawbone right there, and then put the baby so that the baby is across your arm with its legs dangling down usually and pointed downwards, so that you can actually see that gravity is going to help you. Then you're going to look between the 2 shoulder blades. You're going to take your hand right here. This part is what you're going to use, and you're going to go 1, 2, 3, 4, 5. So you're kind of doing a pushing and downwards motion at the same time. Again, that's 1, 2, 3, 4, 5. And remember, you've held the baby like this, not like this, or this, or this. Okay? If something hasn't come out by now, you'll turn the baby around. So the baby was like this. You turn the baby around like this. So still keeping the head of the baby down. Then you're gonna look where the baby's nipples are, and you're gonna put your fingers right on the bone that's in between, halfway in between those 2 nipples. You're gonna put 2 fingers down, straight up and down. This is when it helps not to have long nails, but you're gonna put them straight up and down, holding the baby on your arm with its head down. You're gonna press down, 1, 2, 3, 4, 5. What you're doing is you're compressing the chest about 1/3 of the way, third to half. 1, 2, 3, 4, 5. Just fast like that. Check again, nothing happens. Go ahead and turn the baby on the other arm. Again, head pointed downwards. Fingers like this around the jaw. And 1, 2, 3, 4, 5. Check, nothing. Go ahead. 1, 2, 3, 4, 5. Now, when you do flip your baby from this position to this position. Make sure you're supporting the head and the neck. Do not just hold up here. Do not hold down here, because then the baby's head will fall backwards. So you want to be supporting, when you make the switch, you're making it from here to here. So from one arm to the other. One thing to keep in mind when you're doing the compressions on the baby in between the two nipples and you're going like this, you want to make sure that you let the chest come back up to normal. So you press down and then it should come back to normal. You don't want to keep it pressed and keep going down. That will not give you the desired effect. So you keep your fingers on, but you let them come up all the way before you press down again. You basically keep repeating that until your baby starts breathing again. Of course, if you live in a country where there's access to emergency services, please have somebody call them, or be calling them at the same time as you start all of this, or before you start it if you're all alone. We've been talking about what to do if somebody does choke. Let's talk about prevention, especially in kids. So kids can often choke on things, especially younger kids, because they have a tendency to put things in their mouth and they don't know how dangerous it is. Always watch kids when they're eating. Don't let them run around or be crawling around and eating at the same time, because you don't know what they're gonna pick up. And so always have them sit and eat and watch what they're eating. Also, for kids less than 3 years old, don't give them any toys that have small parts that could break off and that they could swallow it or try to eat as well. Pen caps are shaped just right that they can go down the wrong way and get stuck in the airway passages of kids. So just try to think of these small things that a kid can pick up off of the floor, or maybe you're possibly even feeding it to them and it's too big. So always be sure you cut your grapes, and if you are giving any nuts, that they're very small in size. A peanut is the perfect thing to get stuck in a baby's throat, so be very careful. And when I'm saying baby, honestly, even kids that are older than 1. So even 2-year-olds can have problems with this. Choking risk items include some of the following: eggshells, coins, marbles, grapes, nuts, especially peanuts, raisins, safety pins, pens and marker caps, small button type batteries, hard or sticky candy, vitamins and other medication. Never let young kids chew gum. Balloons. Do not give balloons to children under 3 years old. They can put them in their mouth, and if they pop, then that piece of the popped balloon can go straight into the windpipe and cause them to choke. Small balls, toys with small parts, popcorn. Basically, you don't want to give a child less than 3-year-olds items that are smaller than the inside of a toilet paper roll. So it should be pretty big, and then that way there'll be no worry about them accidentally swallowing something and getting it stuck in their windpipe. The same goes for round, firm foods as well, like little sausages. Cut the food into bite-sized, small, 1/2 centimeter size pieces. If your child isn't chewing yet, please don't give them hard, firm foods. Like carrot sticks, only give them mashed or soft foods. Don't let them run around while they are eating. They're more likely to choke if they're doing that. And then also teach them to chew and swallow before they laugh or talk at the dinner table, as that will also decrease their chances of choking. Hope that helps. So let's just review what we talked about. So for infants, what you're gonna do first is back thrusts. So you go ahead and hold their jaw, put them over your arm, and then 1, 2, 3, 4, 5. Support their head and neck, turn them around, and halfway in between their nipples, using your 2 fingers, you'll compress 4 centimeters or 1.5 inches, which is about 1/3 of the depth of the baby's chest. 1, 2, 3, 4, 5. At a rate of about 100 compressions a minute. Then you will go ahead and hold the jaw again, switch the baby to the other arm, and 1, 2, 3, 4, 5. Hold the head again. 1, 2, 3, 4, 5. And you will keep repeating this process until the baby regains consciousness or the item comes out of the baby's mouth. You may have to just stop after you do a set of 5 and just check. Now remember, if the baby is coughing, if the baby is crying, they are not choking. Just give them a chance. So you can just hold them upright and give them a chance to get rid of whatever's inside on their own. This only applies when they cannot breathe anymore. There's no noises coming out of their mouth. Their face is turning red or their lips have turned blue by then. Those are all bad signs that they truly are choking and they need some assistance. While for infants, we were only compressing 4 centimeters or 1.5 inches. For adults, let's just review what we do. So we place our fingers halfway in between the nipples, except instead of using 2 fingers perpendicular, what we're doing is using our hand, and we're using this part of our hand and not just putting the whole hand down. We are doing this kind of motion, elbows straight, and we're going up and down like that. So it shouldn't be like this. This is wrong. This is right. So as you're doing that, how fast are you supposed to go? You want to go about 100 beats per minute, and you want to compress to a depth of about 5 to 6 centimeters or 2 to 2.5 inches. Again, if you hear cracking ribs, just remember this person will die unless whatever is stuck in their throat comes out. So you are saving their life, and a few broken ribs are worth it. Always try to get help if you can. So if you're all alone, call any emergency services if they're available in the country that you have. And if they're not, then try to yell for help so that someone can maybe get someone who can assist you in what you're doing. Doing chest compressions on an adult is very tiring. Doing it for even 2 minutes makes you extremely tired. And so having somebody who can switch out with you is always helpful. Now that we've reviewed what you do with someone who's unconscious, let's just go over what you do with someone who is conscious again. So if they're older than 1, you're gonna come up behind them. You're gonna put 1 foot in between their 2 feet and brace with the other foot. You're going to bring your arms around their waist, and you're gonna take your non-dominant hand, which in my case is my left hand, and with your 4th finger, with your 4th or ring finger, you find their belly button or their navel, and then you put 2 fingers above that. You take your other hand and you put your thumb in, close your fingers around it, turn it this way, put it right above where those 2 fingers are, and then put a hand above that, and you are going to go up and in, up and in. And you're going to keep repeating that process until whatever is inside of them comes out. So it's always good to prevent things before they happen so that you don't have to treat them. But I hope these videos helped so that if you do see someone who's choking, you yourself are choking, or someone you know is choking, you are able to help them. Both adults, kids, and babies. If you have any questions, feel free to contact us at saveeach1.org. And please continue to watch our health and safety videos at Save Each One.